Now, South Africa and the United Kingdom are set to host the 8th Global Fund Replenishment Conference. The summit will be held in a hybrid format on the margins of the G20 Leaders Summit. This comes as the Global Fund faces a potential $8 billion shortfall against its $18 billion target. The Global Fund Replenishment Conference aims to accelerate the fight to end AIDS, TB and malaria, to strengthen resilient and sustainable health systems, as well as build a healthier, safer future for all. For more on this, we joined on the line by Sherwin Charles, co-founder and CEO of Goodbye Malaria. A very good afternoon to you. Great to have you with us on African Business. Welcome.
Thank you very much, Thami.
So let's start first by focusing on Goodbye Malaria. How does your commitment to the Global Fund reflect the role that African private sector organizations can and perhaps should be playing in global health financing?
Yeah, our commitment, Thami, started back in 2016 when back then we realized how awful malaria is on the continent, still being the biggest killer of young children under the age of 5. And at the time, we knew that it was important for African private sector and African leadership to stand up and be counted. And so we committed to our to $4 million to the Global Fund as part of a leverage of a grant that would be co-funded by the Global Fund, as well as the Bill and Melinda Gates Foundation at the time. And leveraging what we had put on the table allowed us to start with a grant in excess of $20 million. So it was wonderful to be in a partnership that allowed us, as African leaders, to showcase that we could implement malaria interventions across the border. So it covers Mozambique, Eswatini, and South Africa. And having a regional approach helped us align policies between countries and helped us have immense impact.
Looking back now at the impact that these millions of dollars have actually had on the fight against malaria, how would you rate your success? Has there been significant change, not only in the reduction of malaria deaths, but also perhaps in policy that needs to change?
Absolutely. I think the impact, as you said, is not only on the number of cases or number of deaths from malaria, but it's also in the improvement in the quality of life in southern Mozambique and Eswatini and eastern parts of South Africa. We've also seen an increase in community GDPs within that region. But one of the most telling facts is that the hospitals where we work, particularly in Matola, 70% of the beds in the hospital were taken up by malaria cases. Today, you would struggle to see 5% of the beds being taken up. And really, that's allowed the health system to deal with all of the other ailments, particularly maternal health care, within those communities, rather than the beds being taken up just by malaria.
So looking at the shortfall here, you face a potential $8 billion shortfall. What does this mean for malaria elimination on the continent, and how can Africa lead and take the lead towards finding those solutions?
Thami, I think firstly, I hope you're wrong. I hope that we do much better than that in the replenishment on Friday. We still have 3 more days to change that storyline. And I'm hoping we get to much more than $10 billion that we would raise. At those levels, malaria elimination is set back. We not only will not get to meet our targets, but we're also at risk of losing all the gains that we have made in the last 20 years. Malaria is a disease that, if not addressed timeously, it comes back with a vengeance. The mosquito populations flourish, transmission increases, and you see an immediate rise in the number of cases as well as the number of deaths. And so this is something we've got to fight against. This is something we've got to stand up. And one of the ways in which we can achieve that is by ensuring that we have more domestic resources to put to the fight against malaria. We've got to be smarter. We've got to bring innovation and new tools to bear. We've got to do better in our implementation and ensure that we're getting value for money. But it's a big task on our communities as aid across many diseases and many interventions have been cut by the global north.
And what are your expectations for the 8th Global Fund Replenishment Conference? You were saying that you really hope that this $8 billion dollars is not the price tag of the shortfall. How are you going to bridge that gap through this particular conference?
I think with a few strategies. One is that the fundraising just does not stop on the 21st of November. We really have to continue to bring other countries, new donors, and maybe seek top-ups from existing donors. What we've seen is from the G7 countries that aid budgets have been cut and there's been an increase of spending in defense. I'm hoping that we can still showcase what a great investment the Global Fund is. We've saved 70 million lives to date since inception of the Global Fund. We've seen life expectancy in so many of our African countries increase, some by as many as 20 years from the work that has been done and catalyzed by the Global Fund. So we can't give up now, and we can't look at this and think that we have no hope. I think what is so encouraging to see is how African leadership is stepping up to the plate. We just heard that Uganda had pledged $3 million. We know that our own country is leading from the front, and that they're mobilizing resources to show that African countries can transition and do have access to domestic resources. Of course, one of the things that needs to be addressed, which the G20 is tackling, is to ensure that there's debt restructure for the African countries at this point in time.
You mentioned earlier that you work in the Mosaswa region, that Goodbye Malaria works across Mozambique, South Africa, Eswatini. What have you found to be the biggest challenges in coordinating cross-border malaria elimination efforts?
I think that because we've been at this for so long, that we've really got an efficient mechanism for countries to align policies, align timing of interventions, and ensuring that they collaborate in the fight against malaria. But our biggest challenge is really to ensure that our communities believe that they don't have to live with this terrible disease. Part of the strategy is behavior change, and really saying to communities where people can afford it, that they protect themselves and they reduce transmission by protecting themselves from mosquitoes.
Over and above the fight against malaria, there's also the big question of funding post the G20. What do you believe South Africa's leadership role is in shaping the next phase of global health funding? And this is under the G20 agenda.
Yeah, I think we got to show that there are elements around public health that need to be put in place that really will help us make the transition and have it done in a sustainable way. Some of the topics that are on the table is local manufacturing, having a regularized regulatory system that all countries subscribe to, finding efficient ways to bring new products to market, quicker, more efficient regulatory approvals, ensuring that the new tools are supported and are market shaped so that they become affordable and we can scale them up very, very quickly. I think that as a sub-Saharan region, where malaria thrives is us coming together and ensuring that we work as one block in solving the problem. And it can be done. We've seen countries in North Africa that have been declared malaria-free. I think below the equator, we definitely can do it as well. And we have districts in Eswatini, southern Mozambique, South Africa, that can definitely get over the line in the next 3 to 5 years.
Well, Sherwin Charles, we certainly wish you all of the best for the 8th Global Fund Replenishment Concert taking place on the sidelines of the G20 Leaders Summit. Thank you for your time.
Thank you.
Sherwin Charles, their co-founder and CEO of Goodbye Malaria.